The opioids are the class of drugs that includes the street drugs, illicit drugs like heroin, and also the prescription drugs, which include oxycodone, hydrocodone, morphine, along with fentanyl. Opioids are chemically related. They interact with the brain cells and the nervous system with the opiate receptors to give pleasurable effects and also relieve pain. Surprisingly, most of the people who have problems with the opiate drugs, they get their drugs from doctors, either prescribed to them or to one of their relatives. They don't come from the drug dealers from the street. This is overwhelming. In 2015, about 53,000 people died of opiate overdose in this country, most of them from the prescription overdose. On the average, there are about 115 individuals dying every day of opiate overdose. It's as bad as it can get. There are 53,000 people died of opiate overdose in this country in 2015. That's 115 people dying every day, one person every 12 minutes. Opiate overdose was the leading cause of accidental death in this country in 2015. In April of this year, NIH launched a program which is called Helping End Addiction Long Term to address the public health crisis which is stemming from the substance abuse and the opiate disorder, to look at the various studies and do further research into effective treatments, see the extent of the illness, and look at the treatment option. That may be medical option, medication assisted, or some of the non-medical options. The opiate rescue drug refers to specifically the naloxone. It's also called Narcan, which is used to quickly reverse the effects of opiate overdose. And it can actually save lives. It reverses, it binds to the same receptors like an opiate does, and reverses the effects of the opiate overdose, especially the respiratory failure and the respiratory depression. And it works immediately, and it affects lasts up to 1.5 hours. And it can be given by the trained medical professionals, and also in some of the places the peers, the lay people are being trained to give this drug because it can save lives.